In my previous speeches at the National Forum, as Joel mentioned, I've talked a bit about why we need to do what we do, improve, and I have talked about what we could improve. I set out 11 aims in a speech a couple of years ago, areas where we could improve our performance. We know scientifically how to do it. The Institute for Healthcare Improvement has organized a series of efforts called the Breakthrough Series, which is designed to link some of that knowledge to action. We have collaboratives working today on reducing cesarean section rates, reducing waiting times, improving asthma care, and we will start ones in the next several months on reducing errors, on improving adult intensive care, on improving cardiac surgery, and improving care for low back pain, and we'll be forming a community collaborative to reduce motor vehicle injuries. These are action collaboratives attempting to link knowledge to action. Working with these collaboratives has taught me a lot that I did not know about improvement, and I hope you'll learn by joining one of them yourself. But the big lesson, really, I can share with you, it's the same as I learned from my 4th grade soccer team. To improve soccer, you have to know how to play soccer. To improve care, you have to know how to deliver care. To an extent a lot greater than I realized until quite recently, the job of envisioning the new system of work, the job of knowing and explaining how to do better work, is non-delegable. That is, just as it is the burden of leaders, the duty and privilege of leaders, to clarify organizational aim, to insist upon performance, it is also their burden to insist upon major principles of design for the system of work. Leaders have to be prepared to assert not only what must be accomplished, but how it can be accomplished. Now, I don't think that's a comfortable message to give to leaders. I think a lot would like to rely on much simpler notions of empowerment or scorekeeping or feedback, in which the workforce, clinicians and others, are expected to invent the new ways to work. This, in my opinion, is not an effective route to the redesign of the system that we need. The burden of my talk is going to be this: healthcare leaders today have to be able to coach on the actual method of work. We've talked about why we should improve. We've talked about what we can improve. This is the year in which we have to talk about how to improve.